Welcome to My Generation podcast brought to you by South Shore Senior News. I am Steve Dubin, your host. The South Shore Senior News provides entertainment and useful information to seniors, their families, and the professional community who serve seniors. South Shore Senior News is both a monthly print publication. Content is fresh on their website, and they have a robust Facebook presence as well. Our guest today is Tricia Prewett. Welcome, Tricia. Tricia, to give you a little bit of background on her, is a consultant expert on prescription medication and how to get the best possible deal for yours. She has 30 years in the pharmaceutical industry. She is a Massachusetts resident and Medicare enrollee. Impressively, the mother of three. More impressively to me, she's the finisher of the Chicago Marathon in 2021 in under 6 hours. I'd still be out there. And she is a very active hiker, having done 16 of the 48 4,000 footers of elevation. There's a lot more to her bio, but we are limited to 20 minutes, so we're just going to get started. How's that, Tricia?
That sounds great. Thanks for
Okay.
that kind introduction, Steve.
My pleasure. Any rebuttals? No?
No.
Close enough. Okay, good. So tell us a little bit about, your unique business, which is called My Personal RX Advisor.
So Steve, after 30 plus years in the pharmaceutical industry, as I was approaching retirement and noting all the different changes that have happened in the pharmaceutical arena, I kept seeing more and more of a disconnect between programs that were out there and consumers or patients and even physicians knowing about those programs and how those programs worked. So at the conclusion of my career, I did take a little hiatus before deciding to start this business, with the intent of simply doing a lot of consumer education around how those programs can work and the various access points for patients, because it's confusing. Our markets have gotten more and more confusing over the years.
So let's take a simple example. Let's say I use Lipitor. Who doesn't, right?
Right.
A drug that impacts cholesterol. If I were to talk to you about Lipitor, what would be some of the things that you would do, looking at how you could better help me with getting a better price on my prescription?
Okay, so hopefully for the Lipitor, it is now available generically. So I would hope that you are not paying a huge amount of money for that medication. Frankly, one that I get asked about quite a bit is a drug called Eliquis. That comes up quite a bit for folks. That is one that is still patent protected. So in many cases, depending on the person's plan, they can be paying quite a bit for that medication monthly. I've heard of costs anywhere from $35 a month, which is granted not so bad, frankly, if you're a Medicare Part D person, all the way up to closer to $120 a month, which can be significant for folks. The interesting thing to me is that you can have two people living in the same household, taking the same medications, and because our prescription plans are based on the individual, the prices can be different in the same household, right?
Yeah. Okay. And so tell me about how that engagement goes. How do you go about lowering the cost if you find that it is higher than you would have expected and higher than you could probably negotiate or arrange?
Right. So, first of all, I'm not the one doing the negotiation. I am absolutely looking at what works for the individual. And I'm going to go back to let's say we've got two people in the same household, and one person perhaps is still working for a company. I know your audience is seniors, but many seniors are still employed and have commercial insurance. And let's say, for example, the one partner is still working and has commercial insurance and takes Eliquis and is paying $47 to $75 a month. I would direct that person to go to the website for Eliquis and sign up for the manufacturer coupon that will bring that copay cost down through their employer plan from the $35, $45, $75 a month, depending on that plan, to zero, $5, or $10 a month, simply by signing up for that manufacturer's coupon and program. Let's say the other person is retired and they're on Medicare Part D and they are also taking Eliquis. And I can tell you right now that if they're paying $35 to $45, $55 a month, I would simply say to that person, yay, your plan is great. You're actually doing quite well. What you can look forward to as a Med D patient is that Eliquis happens to be on the list that's been negotiated for implementation in 2026 for the federal government to reduce or negotiate those prices for Medicare Part D patients. So arguably, the first person who's still on commercial insurance, they could walk away going, yay me, I just figured out how to save, 25, 35, 45, and it does depend on the commercial insurance plan. And there are many of them, so I cannot promise it would go to zero, but I can direct that person, instruct them how to utilize that coupon, how they take it to their pharmacy, all of those kinds of logistics about putting that into place. And then the other person, I would simply say, sorry, you got to wait till 2026, but I can tell you right now, you picked a good prescription plan on your Med D because you're getting about the best price that you can probably get. Thirdly, which does happen sometimes, I also know that the manufacturer of Eliquis has a patient assistance program. Now, if that person on Med D is on a fixed income, I happen to know this one, it needs to be fairly low at about $36,000 a year, higher than an extra help, but not that high, frankly. They might qualify for the patient assistance program, and I can help to direct them to that particular tactic to see if they can get approved for free medication that gets sent to their home. So the reason why I called this my personal RX advisor is because every single person is unique. There is no way for me to say, here's the answer across the board for this medication, because it's just not true. And it's just not how our markets work in this framework.
Well, and so to avoid some of those missteps, do you also consult with folks on how to, based on their current position and their personal situation, which part of Med D they should choose?
I do not.
Okay.
And this is where I do have people who call me and think that I am an insurance broker or an insurance agent that can help to pick their Med D plans when it comes time to choose. I have relationships with trusted advisors that are licensed insurance agents. So, like many people, I can give them a list of here's one, two, or three of people that I know. Feel free to talk to them. Um, they're great resources for folks. And I feel gratified when somebody that I refer to somebody else gets back to me and says, oh my goodness, that agent was great. I'm now on like the best plan, and going forward in 2024, I'm saving X number of dollars, and they help me pick the right plan. So I like to call myself the here and now gal. I do very much encourage people to look at their medication list going into that open enrollment period that we hit October 15th through December 7th, I think is when it hits for the majority of people. Because it's important to be smart to pick, especially if you have important medications that are expensive, to pick a plan that matches.
Okay. And so tell me your I'm sure you have all kinds of engagements, but what is a standard, what would be sort of the most common kind of situation you run into?
So there's really about two. It is, oh my goodness, Trish, I'm okay with most of my medications, but this one is kind of cleaning my clock, or maybe two medications that are costing a boatload. And sometimes, Steve, it's even generics. I mean, what I'm learning is that many of the plans have now moved generically available medications into that tier 2, tier 3 kind of range, which can be pretty expensive for people. And in that scenario, I really do like to recommend looking at a Good RX coupon or a single care coupon, or something like people may have heard of Cost Plus Drugs, which is a new or direct to consumer. It's a public good kind of company that's been started by Mark Cuban. Frankly, I'm in love with their website. It is so easy to negotiate. They started with 100 medications initially in 2022. So it's still really a very young company. They now have over 2,000 medications that they have, and it works much like a mail order for generics. And for higher price generics, it can be fabulous, especially if people are taking 2 or 3 or 4. You know, I could go kind of on and on, but I mean, for example, lidocaine patch. Okay, a lot of people use a lidocaine patch for pain, or at least that's one that has come up frequently. That typically on a Med D plan or even on a commercial insurance plan can run about $120 to $165 a month. That's available on Cost Plus Drugs for mail order, depending on the dose, starting at $45 to $85 a month. That's a huge, I mean,
Yeah.
that to me is real money for people. But again, if you're using something like Cost Plus Drugs or a Good RX coupon, those entities are, quote, not insurance. So you are not using your prescription benefit at all. You are choosing to say, hold up, I don't want to pay that $165 a month for that tier 3 generic and use my plan. I would rather go over here and send my prescription to this newer entity and pay $45 to $65 a month. So my job or my role is to simply work with people individually to coach them and let them know what their options are.
Okay.
Right? Due to HIPAA, I don't ever pretend to change a medication. I am not a prescriber. That's not my role. My role is to simply say, hey, you're paying this much money. If you want to look over here, these are your options. And then it's up to you as the consumer, now an educated consumer, I like to think, to say, you know what? I'm going to do that instead. Right?
Yeah. Okay.
So the other people I get asked for is, can you work with my mom or dad? I mean, I'm in the position now where I've still got seniors in my life. And part of how this even got started was being at barbecues or whatever. And people would come up to me and go, hey, Trish, like Auntie so-and-so's doing this, 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 and this. And I'm like, whoa, because I can't pretend to know every single medication. But of course, as they're adult children, they're concerned. And they're also concerned that they might not choose to fill the prescription because of cost. And then that gets into a whole other layer of, we want people to be able to take their medications as their physicians, their providers want them to, right? So
Sure.
that's my goal, is to have it be a win-win, in terms of I had one gal who called me and she's like, I don't even want to be on the FaceTime call with you because I can do a 3-way call between the patient, the adult child, and myself. And this was a woman, and she said, I can't talk to my mom anymore. She's making me crazy. I want to be out of the loop. I want you to talk to her, but I also want you to know that this medication that she is threatening to go off of, she needs to stay on it. She needs to stay on it. So please try and help her figure out a way that she can stay on this medication and afford it. So I keep it personal. I mean, because everybody's situation is different.
But the end user, your customer, has to take the action themselves. You're not actually doing any of the change within their, yes.
That is exactly true. And that is for many reasons. It is medications, HIPAA. I can tell you, Steve, that when I'm working with patient assistance, I basically throw out the number like I did for Eliquis, knowing that their program, they do have a program, but the gross annual income is like 35,000 something. That's pretty low. I had another lady that I worked with last year who, lo and behold, that income level was close to $80,000 a year. And she was able to qualify for patient assistance. Now, I would argue that $80,000 a year on a fixed income is not a bad deal, right? So I was surprised as well. And yes, I got the application to her. We talked a number of times, but she had to go to her doctor. She had to get that form signed. And so she was a feisty 80-something-year-old, and she was willing to do it. And I have to say, I got the call in November last year where she was so cute. She said, I just want you to know, Trish, she's like, they approved me for next year. They sent me one piece of paper and I ran to the copier and I copied it and I mailed it off right away because it was the end of the year when she got approved. So they had approved her into 2024. So that was very gratifying to me because that medication had been costing her, and before the donut hole, about $600 a month. And after the donut hole, like 2,000 something. So she was very grateful. And it didn't happen overnight. And it took some work on the part of the client to be able to go to her doctor and do those things. And by the way, she was in Florida. She doesn't even live here. So I can work with people all over the country, as long as I've got zip code and some basic information about their plan.
Okay. And could you just explain donut hole for those who are not used to that language?
Oh boy. One
In
sugar
brief.
and brief. So typically when you are a Medicare patient, you have a certain benefit that's built into your prescription plan until you hit a certain threshold. And I believe, ugh, I don't want to be quoted. The threshold, I think, is about $6,000 in benefits. And then you are responsible for everything else until you hit a threshold. And those rules are changing. They keep coming down every year. I didn't put my cheat sheet in front of me. So,
That's okay. That's all right. I just wanted a general explanation because I think that although that phrase is very common and known to many, it's not known to all. So
true,
that's
very true.
only reason I wanted clarification. Okay, and then how do you get paid? How do you? What is your business model?
So, so my business model is really very consumer education, patient driven. Um, I have a do-it-yourself guide on my website that I've put together for $9.99, which is a thoughtful 12-page, how do I do what you do? Because, hey, I'm pretty smart, except for when it comes to medications, maybe I want some guidelines and some framework around that. So the $9.99 do-it-yourself guide is designed so that people can take my thought process, follow what I do, and do it themselves. Secondarily, I charge $45 to do a review of one product. I charge $75 to do 2 to 3 products. And that intake is simply, it's generally a phone call, because I like to talk to people rather than kind of go back and forth via email and
Sure.
get us and gather that information. So I can do a comprehensive review. I've had a few clients who wanted me to do a comprehensive review, and that is priced kind of based on how much work it's going to be and how many drugs I need to do investigation of. And then process wise, do an intake. We talk about what I'm going to do. And then in 3 to 5 days, I disseminate the information back, generally by email. I also, in many times, follow up with a snail mail package. This stuff can be a little complicated, and um, lots of times people like to look at the documents rather than kind of looking on the screen going, I think I understand that. And then I do a follow up with after the package has been received to go through. I call it my personal action steps. Do you know what you need to do next? Here's your marching orders. Now go do it and then report back to me, because I like to close that loop. I like to find out, did my recommendations pan out for you? Did that really work? And how hard or easy was it? Right?
Sure. Great. Okay. Well, we're coming to the end of our segment. I'm sure people are going to want to talk with you directly. And I understand for our audience, you're offering a 10-minute consultation, and you also have a worksheet available on your website that helps people organize their medication and put in some detail about it so that both they are better informed and can share that with their health providers as well as potentially get better pricing for those medications, correct?
Correct. And the starting point really is filling out that worksheet, or at least having a list in front of the client to say, here's my medications, here's what I'm paying, and let's get going from there. The best way to reach me is I do have a number that people can call, which is 508 507 8840. I do try and pick up my phone, but I am a small business. So please, if it goes to voicemail, let me know your name. Let me know a good callback time and number. Like many of you, I get stupid spammy calls. So if you don't leave a number, I'm going to think that you're some spammy person. But I would really like to talk to you. And then the other way, as you mentioned, Steve, I do free 10-minute consultations. I like to direct people to my website to book that. It is under products and services at this point, but I don't ask for a credit card. I don't ask for any kind of financial information at all. I just need your name and your phone number. And by booking online, we know that we've got a time set aside to talk to each other. So if you've got questions and you want to set up a time, simply go to my website, which is My Personal RX Advisor, and then check for the products and click on that free consultation link to book your time. All right.
Okay, terrific. Well, thank you so much for your time, your insight. Um, I've picked up many useful nuggets. Thank you.
Okay, I hope so. Sometimes people just say that to me. I had one of my gentlemen who said, I got that notice. It said my drug's no longer covered anymore and it's going to be $335. And he said, because I had talked to you already last year, I knew right what to do. And I love that. So
Awesome. Okay. Well, thank you again, and thank you for the good work you do for seniors and their families.
all right. Thank you so much, Steve. I
All
appreciated
right.
being a guest.